Hello, I'm Michelle Postons and I work at Greyfriars Medical Centre in Dumfries. On behalf of all of the staff at Greyfriars, I would like to talk about how we are working with you during the pandemic to provide the best service possible to meet your needs. This is not just about what we are doing, it is about what you are doing too, managing your health so well in such difficult times. Like other practices across the region, we are open and we are very busy. We want to let you know we are here and we are providing our service, but in a different way than before the pandemic found its way into all of our lives. We hope we can explain some of that to you now.
Hello, I'm Erin Barrett and I'm a GP. Our large team at Greyfriars is made up of 8 GP partners, 3 advanced nurse practitioners, a nurse practitioner, 3 practice nurses, a team of healthcare assistants, GP trainees and all of our administration, reception staff who help and support us to provide the service that you need. We are fortunate enough to also have in-house access to a pharmacy team and a mental health nurse. We have approximately 12,000 patients and we undertake up to 215 patient consultations every day. This does not include healthcare assistant appointments for routine checks such as BP monitoring and blood taking. At present, this is largely made up of telephone consultations, some near me video consultations and a smaller number of patients attending in person where it's crucial they are seen to ascertain what the problem is and what is needed to get them the right help or treatment. For now, we have to undertake our consultations in this way to keep you safe.
Hi, I'm Debbie Swalwell and I'm also a GP. It's so important to tell you that like all GPs across the region, we miss our patients coming into our waiting rooms and into our consultation rooms. We miss the face-to-face contact as much as you do. We look forward to a time in the future when we can provide your healthcare needs in this way again. For now though, we have to do this in other ways. For example, we are spending a lot of time over the phone with you, and that means we have to ask a lot of questions to get to the root of the problem. In some cases, after that phone call, we may still need you to come into the practice so that we can examine you in person. Often, we're asking you to send us a photo of something you're trying to describe to us, for example, a rash or a skin lesion. We need to understand what is going on with your health and identify what treatment you need, but we also need to reduce physical contact. This means we all need to be patient while we do that as safely and effectively as possible.
Hello, my name's Emma McCulloch and I'm one of the advanced nurse practitioners from Greyfriars Medical Practice. We have had to work in very different ways during this global pandemic with limited resources and access to some of our services. It's made it a lot more difficult at a peak time when routine services, for example physio and psychology, have been reduced. Please remember that we absolutely strive to do our best for our patients. Some of the ways in which we're doing this during the pandemic has been signposting you to information and resources for self-help and musculoskeletal problems. For example, we use the NHS Inform service. We know that this can be hard for some patients, but we also know that there's a lot of good information and resource that can be really effective when used well. Thank you.
Hello, I'm Dr. Pira and also a GP. For concerns about something that may be of a serious nature, such as a new lump, abnormal bleeding, a persistent cough, or an altered bowel habit, please don't delay in contacting your GP. We still operate as timely as we did before the pandemic, where there is a suspicion of a serious illness. We continue to refer urgent cases for further investigation where necessary. We are open and we are here to provide the best service possible in these times of the pandemic. On behalf of everyone at the practice, we look forward to the return of some sort of normality in the future. We want to thank everyone for their patience as we have navigated and continue to navigate our way through these difficult times.